animations are hard to invent, hard to create, and easy to replicate. Because once you have your node workflow ready, it's easier to change some small details. So it's much harder to create a perfect workflow that depicts a pneumothorax happening. Yet once you have the left pneumothorax animation, for example, if you want to create a right pneumothorax animation or a double pneumothorax animation, it's all of a sudden much easier, because now all you have to do is tweak some little details in your vast node tree and cause this specific causality to apply to more than one side of the image, for example. And what I mean by this, and I'm not a programmer, I'm a medical doctor, so perhaps my logic explanation is not the best I've ever seen. It's not the best you've ever seen. But the whole idea is that it may take weeks to build the correct structure to generate your animation, and once you are done, it pretty much turns into a assembly line. You can make a lot of different variations of the video. However, it's extremely time requiring. So even if you want to make a single animation, expect to spend like 40 hours on it. That's my personal experience. After you have the first one ready, the subsequent ones are faster.